Yeah, my name is Catherine Mbabazi Ngoro. I'm coming from Uganda. In 2022, I got a rupture of the vessel in the brain, and my doctors in Uganda referred me to India, and Dr. Girigani Suresh here at Apollo. That ruptured vessel had brought in very many complications. Part of it was a very acute hydrocephalus that left the cerebral spinal fluid passage very blocked with many clots, and that was also another issue. Dr. Suresh Girigani referred me to neurosurgeon, Dr. Alok Ranjan. But in that process of doing the evaluation exercises, they discovered that I had an ovarian cyst and it was growing. And I felt at that point that the ovarian cyst should also be removed. But then Dr. Alok said, no, we have just done a comprehensive surgery of the brain. I request that you give it 1 year, and maybe after 1 year, we can try again and see what can be done. So after I think it's now over a year, I decided to come back, look at the ovarian cyst. But my coming this time was not the focus of the ovarian cyst again, but was the focus when I was operated here in the brain. There is something they put, which they called a reservoir, a tank. And that tank was supposed to operate that whenever fluid is excessive in my brain, they tap with an injection, pull out the fluid, and reduce the pressure on the brain. And I was told that it's not supposed to be in my brain for more than 6 months. So I wanted Dr. Alok to remove it. But again, in this process, these evaluations, again, another doctor discovered that the ovarian cyst was growing, and now it was in 5 centimeters something. The medical language, I'm not very sure about it. So he decided, Dr. Alok referred me now to Dr. Rooma Sinha. That's how I get into her office, and we start chatting about this cyst. We do several checkups. She discovers that it was going to be, and it was important that we remove it. It had been for long, and it was likely to turn into a cancer. So following the discussion between Dr. Alok and Dr. Rooma, they agreed that ovarian cyst be removed. And I was scheduled for surgery, which happened on Monday, a week from now. And I'm happy to report that after the surgery, I woke up easily. I recovered quickly. I was in ICU. The doctors were very nice, and the nurses, they took care of me well. I was put to the ward. The ward staff was also very kind. And to my surprise, after 1 day, I was able to walk. After the surgery, I would walk easily. And following that, I was, of course, discharged and going home. What I call home here, I've been living at Apollo hostels, and they were also nice and receptive. So overall, I would like to appreciate all those doctors that I've interacted with. They have been friendly. Dr. Rooma and her staff, Dr. Rupa and the entire team, they were all friendly and comforting. Thank you, Dr. Rooma. Thank you, Dr. Alok. Thank you, all doctors who have worked on me. Thank you, Apollo Hospital, Hyderabad.
Hi, Mrs. Catherine had a successful surgery with us. I'm Dr. Rooma Sinha, Senior Gynaecologist, Robotic and Laparoscopic Surgeon at Apollo Hospital, Hyderabad. Mrs. Catherine has been our patient for a very long time, and she has underwent multiple surgeries, management by interventional radiologist, and a brain surgery in the past. She was a high-risk patient. but she had a persistent ovarian cyst for a very long time. And this cyst had some suspicion of being cancerous. That is why, with full precaution, with multidisciplinary team, we managed to do a laparoscopic oophorectomy for her, and thank God the results were benign cyst. So this is a story or a journey of a patient with multiple medical problems, which with a multidisciplinary approach is very well managed in places like Apollo Hospital, Hyderabad.